then you can take off your masks based on judgment. First, there will be some remarks given by Prime Minister Abe. Then after that, we take questions from the floor. Mr. Prime Minister, the floor is yours. The summer heat is going on. To the people in Japan, we'd like to appreciate their countermeasures, their support to the people of the COVID-19, the summer heat measures. We appreciate what they have done. From the government, there have been requests from the local government, central government. We have to appreciate what they have done for us. On COVID-19 countermeasures, since January this year, we have been fighting against invisible enemy. We try to minimize infection as much as possible. We try to avoid the severe symptoms of the people, to protect the life of people from time to time based on expertise. The government has done its level best. That's what I think. But quite regrettably, many people have been affected, infected, and some of them died. I'd like to express my cordial condolences for those victims. At this moment, doctors, nurses are trying very hard to treat the diseases of the people. I'd like to appreciate what they are doing right now. Today, then from summer to autumn, then fall and winter, we made decisions on government countermeasures against COVID-19. Many facts have come to light during the past 6 months. By taking out countermeasures to avoid 3 Cs, strike a balance between the preventive measures and social economic activities is possible. We have seen advancement of the treatment drugs such as remdesivir. The fatality rate of the people under 40 years old is 0.1%. Half of the people who died are in their 80s and over. There are high risks of severe symptoms for elderly people and people suffering chronic diseases. We try to save a life of the people. The most important key for the government is how we can deal with the countermeasures for those people. Winter is coming. Then on top of COVID-19, the seasonal flu may rise. We may have more people with fevers. We have to reduce the burden on medical systems. Then we're going to have a focus on the people who have high risks of infection. We have to change the way we take countermeasures. We have to enhance testing facilities. By winter, we'd like to make it possible that 200,000 tests can be done for both seasonal flu and COVID-19. 200,000 tests. Elderly facilities, hospitals with the high risks of infections, based on infections, we ask the staff members of facilities to take a PCR test on a regular basis so that we can prevent mass infection on people with chronic diseases and the elderly people. When it comes to medical systems, the focus shall be placed on the people with higher risks for COVID-19 infection. On COVID-19, based on SARS, then TB and MERS, those diseases are classified as the Category 2 in the Infectious Disease Act. The COVID-19 was on the par with those diseases based on the changes in cabinet orders. We have a review on the status of the disease. People with no symptoms, people with mild symptoms will be asked to recuperate at hotels and their homes so that we can reduce the burden on medical systems and doctors, hospitals. Some hospitals, the university hospitals, have accepted the COVID-19 patients. They are suffering in the reduction of their incomes. They are finding themselves in a bind in terms of the business. We like to put out all the stops to give a helping hand to those institutions. Even though the seasonal flu happens, we like to have a system to treat the disease and COVID-19. We have contingency budgets. Those budgets will be executed immediately. Together with COVID-19 countermeasures, we shall never have a vacancy in the very strict security environment surrounding Japan. We have to deal with that. North Korea has enhanced its capacity to launch ballistic missiles. In response to that, does it suffice we can protect the life of people in Japan and by having the intercepting capabilities? 2 days ago, we had NSC meeting. Then we discussed on a new policy on the missile, the defense systems. That will be discussed in the ruling parties to make it a reality. Those are the two messages I'd like to report to the public in Japan. Now let me talk about my own health.
13 years ago, my chronic disease, ulcerative colitis, emerged. In 1 year. Abruptly, I needed to step down as a prime minister. Back then, I caused the massive troubles to the public. And then we had a new drug, and I was ready. I was healthy. With the support of the public, once again, I decided to take on the significant responsibility as a prime minister. During 8 years, I controlled my chronic disease without any issues. I kept on focusing on my job as a prime minister on a daily basis. I put all out effort. However, this year, in June, I had a regular checkup. There was a sign of the disease. That was what my doctor said. And I have been using my drugs, and I put all out effort for my job as a prime minister. And mid last month, there was some condition in my health condition, and I was short of my healthiness. And in a ulcerative colitis, resurgence was emerged. Going forward, on top of the drug I'm taking, I will be taking the new drug. Earlier this week, in a checkup, there was an efficacy of the drug. It was confirmed. However, I need to have the continuous drug administration, so I cannot lose focus on my treatment. What is most important in the politics is to deliver on the results. Since inauguration of the administration for the 7 years and 8 months, in order to generate the outcomes, I put out all the stops for my job as a prime minister. I needed to fight against the disease and be treated, and I was not really in a perfect state in terms of the health condition. And still, I have to make political decisions, the important ones. I cannot make any mistake in terms of the important decision making. The support of the public is I have to respond to. So I'm not ready to respond to the mandate by the public. And I made a judgment. I should not continue my job as a prime minister. I decided to step down as a prime minister. The most significant challenge for us is the countermeasures against the coronavirus. We have to avoid any obstacles when it comes to fight against the coronavirus. For the past a month, that was the only focus I had. I really struggled to make decision. I see the downward trend in infection after July, and also toward the winter, the necessary measures have been put together. Therefore, under the new leadership, the challenges should be addressed, and this is the only timing where the leadership change should be happening. For the past 7 years and 8 months, we have addressed a variety of challenges. There are a lot of the challenges we haven't completed. At the same time, there are some achievements and there are some milestones that we hit in order to respond to the mandate. All the achievements are thanks to the public and people of Japan. I really want to extend my appreciation to the people of Japan. Despite of the support, even though I have 1 year to go in my tenure, and with other challenges that have not been addressed yet, and amid the coronavirus outbreak, I decided to step down as the Prime Minister. I would like to send my apologies to the people of Japan.
I wasn't able to solve abduction issues involving Japanese nationals. It is indeed a source of regret. The peace treaty with Russia, constitutional amendment. I'm going to leave my status without achieving all of those ambitions and targets. It is indeed a regrettable thing for us, but it is a commitment made by the LDP to the people in Japan. Under the new leadership of the party, we're going to work out the new policies. We're going to have a new engine for growth and for momentum. Then those measures will be executed. Next Prime Minister, before he or she is appointed, the onus will be on me. I will take my responsibility as the Prime Minister of Japan. I go through treatment, then I'd like to regain my health again, so that I'd like to stand behind a new administration as a politician. To the people in Japan, I'd like to appreciate your support for about 8 years. Thank you very much indeed. Then we'd like to take questions from reporters, first based on practice. We take questions from 2 coordinators, and if your name is announced, then please go to the mic. Then please state your affiliation and name, then ask your question.
Now you can ask a question. Nihon TV, Sugawara, thank you. So you decided to step down as the Prime Minister. As you said, the continuous administration of the drug will continue. Maybe you could have considered the option to serve as a Prime Minister and be treated. So I believe your health condition is very severe. Are there any necessity for you to go to the hospital continuously? So when did you make a decision to resign? And in the first administration, you needed to quit, and this is the second time for you to do that. There may be some criticism that you gave up in halfway through. How would you respond to that? Political vacuum cannot happen. How the successor can be decided? So there will be official voting. Do you think the official process should be happening, or because this is the immediate process, do you think there should be joint plenary meeting of party members? Do you have any particular person in mind that should succeed your job? You asked about the treatment of my disease, and on top of the drug with the IV, the treatment will continue. So there was a second administration, there was a health checkup, and we started to see the efficacy of the treatment. Yes, I did consider the possibility of continuing the treatment as serving as Prime Minister after June. There will be important personnel decisions to be made in September, and the diet session will be starting. There was no guarantee that my health condition would continue to be better, so that after the completion of the administration of the drug, the treatment could be over, but there's no guarantee. Amid the coronavirus outbreak, we shall not generate any political vacuum. That is why I had no choice but to resign at this particular timing. Last week and this week, I went to the hospital to receive the checkup. So that was the decision I made after the health checkup this week. It was on Monday. Yes, this is still in the middle of the tenure. I have to take those criticisms that may arise. But as I said in the beginning, in the autumn and the winter, there will be an influenza season. We put together the countermeasures for that, and those packages were put together today, and they should be implemented. Now we have more visibility to do that. And we see the downward trend of the infection. That is why I made a decision at this particular timing, the presidential election for the successor. So thinking about those timeline, this is the only timing to minimize the impact. That is why I made such a decision. As long as I serve as a Prime Minister, I take the responsibility to fight against the coronavirus. Fortunately, so the drug is very effective, so I will continue to do that for the time being. For the next president of the LDP and how next person should be elected, the senior positions will decide that. So I am not in a position to talk about that. I am not the one who should talk about who will be the next person.
Okay, let us have a question from the other coordinator. This is Imai from PM Abe, and just now, then you said that you have done your level best to show the result. Among your achievements, by myself, and what is the legacy of the administration? Would you please show us your examples? The task to be done, the constitutional amendment, the abduction issues, and peace treaty with Russia. What are the important assignments that you'd like to pass on to your next Prime Minister? You asked a question about the legacy. It is up to the judgment of the people. I think the history will show what the legacies are. When my administration was launched 7 years and 8 months ago, the recovery of Tohoku region was a prerequisite for the recovery of Japan. I said that government is going all in to recover the damages in Tohoku area. On economy, the people who like to work can work. We have to create job opportunities for people in Japan. That's quite high on agenda for my situation. Japan was haunted by deflation for 20 years. We have 3 arrows. We created jobs for more than 4 million people. Based on the fruits of the growth, and we provided free the high school education, the nursery school education, the work style reform. Then all the people in Japan can work actively. I think we have made a step forward to achieve those achievements. For national security, on the collective self-defense, we set the peace and security legislation. We have enhanced a system to support with each other. The U.S. President went to Hiroshima, then we had achievement. The alliance between Japan and the United States is the basis of our diplomacy, to have a panoramic view of the world in our diplomacy. There are many important matters: EPA, the TPP, Japan-US trade negotiations. Japan took the initiative to create an economic bloc with freedom, and which is fair. Then that's what I think. Whenever a national election was held, people gave his support to my government. My special thanks go to the people in Japan. As you said, abduction issue, the peace treaty between Japan and Russia, constitutional amendment, all of those issues carry greatest importance for the government in Japan. Quite regrettably, it is indeed regrettable that those assignments are yet to be completed, but it is a commitment given by the LGP and the government to the people in Japan. So therefore, after the next strong leadership system is established, I think then my successors will try very hard to deal with those matters.
Now we take other questions. Please raise your hand when you want to ask questions. When you are called, please come up to the microphone, state your affiliation and the name, and ask questions. I think many people want to ask questions. Please ask only one question per person. Hoshino-san, please. Hoshino from Asahi newspaper. Thank you. What is your expectation for the next administration? And there are the number of people who could be the successors, Mr. Suga, Mr. Ishiba, and Mr. Kishida. What is your personal opinions about those people? So I will be stepping down, so I should not make a whole lot request for the next administration. The successor, the Prime Minister, I believe, will be making utmost effort for the era we have to live with Corona and after Corona. We have laid out our visions, and those visions should be shared, and we expect the next person to achieve the results as we dealing with the new normals or new lifestyles.